This segment of Delmarva Life is brought to you by Delmarva Chiropractic.
Well, there are a lot of other ways we can end up with aches and pains, and this is usually the time of year that we do it. With warmer temperatures, we're all trying to get out into the yard and get all the gardening done in one day. I'm guilty. Or it's time to get back in shape so you can play on that softball team or try 18 holes of golf after being sedentary all winter. Well, the doctors at Delmarva Chiropractic say it's better to address pain early in the season so you don't end up spending the summer benched. This time of year, Dr. David Brown not only sees sports injuries, but injuries received from those just trying to get things done.
Spring has started, everyone's out gardening, throwing out 8, 10, 12 hours out there, and they haven't done anything all winter. So, when you're talking about sports and sports chiropractic, it's just not the athlete, it's the weekend warriors, it's the people who are getting into it, again, for the first time or, at the beginning of a new season.
Treatment of sports injuries or injuries caused from just plain overdoing it have a lot in common.
The whole sports chiropractor goes basically outside the spine. We look at the biomechanical model. Everything in the body is basically related. So, the spine has a pronounced effect on the lower extremities. Well, the feet, the knees have a pronounced effect on how the spine actually works and functions. So we actually look at both models.
In other words, if a patient has a back pain, Dr. Brown wouldn't necessarily start with the back.
Generally, a history is the best way to go. You can go through a big, thorough history. You can measure people's feet. You look at their gait biomechanics, their stride length, their width, how much rotation is occurring in the hips and the pelvis, how much lateral sway is occurring. But the history is going to be the best one, especially when you're dealing with athletes.
And treatment is never a one-size-fits-all solution.
It's all pieces of the puzzle. There's no such thing as the right answer. And if you look at people who manage pain, you have chiropractors, you have massage therapists, physical therapists, podiatrists. It just goes on and on and on. No one has a complete right recipe, but there's always pieces to the puzzle. Rehab is incredibly beneficial. Soft tissue work is incredibly beneficial. Making sure people's footwear and foot biomechanics is incredibly important. Having an appropriately mobile joint is incredibly important. So there's all these aspects that you have to look at, and it's just another piece of the puzzle to help improve overall outcomes.
Techniques to achieve those outcomes are not limited to chiropractic adjustments. Delmarva Chiropractic is certified to use what's called the Graston technique.
Graston is a wonderful technique that uses instrument-assisted soft tissue mobilization. I think is a fancy term for it. But basically what you're trying to do is break down adhesions or restrictions that exist within fascial planes or within fascia to help restore the normal function of the tissue.
Fascia is a thick, tough, elastic type of connective tissue that wraps most structures in the body.
If you ever cut up chicken before, you notice that white stuff that sort of surrounds the muscle. Well, that's fascia. And it helps create compartments. And when you're talking about muscle bellies, those compartments of two opposing muscles need to be able to slide and glide past one another. And there are instances in research that show models that stops occurring. And fascial manipulation will help restore that normal function to the fascia and the soft tissue and muscle as well.
Dr. Brown says depending on how bad your injury is, you probably won't have to spend a lot of time in treatment.
Average treatment plan is about 6 to 12 visits. Okay? We have people that take much, much longer, especially when you start talking about neurological concomitants associated with that. But when you're just talking about a pure biomechanical model, 6 to 12 visits, people are having significant results.
Obviously, the doctors at Delmarva Chiropractic do not want patients to get hurt again, so they offer coaching on certain activities that they should avoid or do differently. And if you would like to learn more about Delmarva Chiropractic and the services they offer, go to our website, WVOC.com, click on our picture at the top of the page.